Assalamu alaikum. So in this video I'll just be going through some structures on the dorsum of the foot and some other important structures that are left. Okay. So first of all, this is the lateral side of the foot. As you can see, this is the lateral malleolus calcaneum. This is the peroneal or fibular retinaculum. Then this is the inferior part of extensor retinaculum. I'll show you properly in a moment. So the structures that are passing through the fibular retinaculum are two muscle tendons. First of all, the tendon from fibularis longus muscle. So the tendon present a bit posterior is the tendon for fibularis longus muscle. As you can see, I'm tracing it. So fibularis longus muscle, tendon of fibularis longus. Then right underneath it you have the fibularis brevis. So longus and brevis, and both of their tendons are passing through this retinaculum. This is the extensor digitorum. This one is the extensor digitorum muscle. So if I remove this muscle, if it is removed in the OSPI, as we've already discussed, this is the anterior tibial artery and the peroneal nerve, deep peroneal nerve. So right next to it we have this membrane-like structure, this white membrane-like structure. This is not the bone. As you can see, the bones here, right here, this is not the bone. This is the interosseous membrane, this one. I'll try to show it better. This one is the membrane, and this and this, these two are the bones. So some other important structure and the dorsum of the foot. This is the inferior band or the inferior extensor retinaculum. Okay, so if I put this back right here, now I have put the muscles back. This is the extensor digitorum, and right next to it you can see I've marked this one. This is the tendon of the digitorum, and this one, the 131, is the tendon of extensor hallucis longus muscle, digitorum and extensor hallucis longus muscle. So as you know, the tendon of the digitorum muscle divides. So after passing through the retinaculum, you can see all these tendons from the digitorum muscle. Okay, so this tendon that is of extensor hallucis longus is going up to the big toe. As you can see, from here straight up to the distal phalanx of the big toe. Okay, so this is extensor hallucis longus muscle. Then we have the muscle extensor hallucis brevis. So this muscle, it's a bit diagonal and you have to look at it clearly. This muscle is coming from the side and it will attach to the middle phalanx of the big toe. So this is the extensor hallucis brevis. So this is the longus and this is brevis. And the other muscles, like I've mentioned in the previous video, all these four muscles are the dorsal interossei. 1, 2, 3, 4. Dorsal interossei, and this is the tendon for peroneus tertius or fibularis tertius. This is the tuberosity. Okay, so now I will move towards the opposite side. This is the dorsalis pedis, and this is the branch of deep peroneal. This part right here, this aponeurosis, is the dorsal digitorum aponeurosis. As you can see, it is present on each and every one of the toes. Okay. So now we've moved to the medial side. On the medial side, I'll just try to show you. So this muscle, tibialis anterior, continues from underneath the retinaculum tibialis anterior underneath the retinaculum, and this is actually its tendon. This is a tendon of tibialis anterior. Okay, so I'll just move the model towards the side. Okay. Okay, now we're on the medial side of the foot. So this is the medial malleolus, flexor retinaculum, and the structures passing underneath is posterior tibial tendon of posterior tibial muscle, flexor digitorum tendon, posterior tibial artery, tibial nerve, and flexor hallucis longus. So just a repetition, we have the tendon of tibialis posterior, flexor digitorum longus, posterior tibial artery, tibial nerve, and lastly we have the flexor hallucis muscle. This is flexor hallucis. Now we'll just go through some of the structures that were left behind, not behind. Okay, obturator internus. This is actually marked on the cartilage. This is not the bone. If the bone was marked, it would be in the front. If it is blue, that means it's cartilage. So this is a fibrous disc between the two pubic symphysis. Okay, so this part, so this right here is the sacrospinous ligament. It connects the sacrum to the ischial spine, so sacrospinous ligament. So if the point is here, this is the coccyx, sacrum. Here we have the lumbar vertebrae, with intervertebral disc. So this is the posterior side of the model. This is the gluteal region, and now I will remove this muscle. This is the gluteus maximus muscle, which I will remove. So I've removed this muscle, and I will be, we've done these already. So here, this ligament that is connecting this part, that is the sacrum to the ischial tuberosity, is the sacrotuberous ligament. So on the inside we had the sacrospinous ligament connecting the sacrum to the ischial spine, and on the posterior side we have the sacrotuberous ligament that connects the sacrum to the ischial tuberosity. So one bony structure that is present here, right here, this is the greater trochanter. This part, this is the greater trochanter. You can see as all a part of the muscles are attaching to it. So greater trochanter. So these are some important points on the leg. I hope you found this helpful. Thank you.